everybody, Dr. Corey Singer here today to talk to you about R.I.C.E. versus M.I.C.E. So these are acronyms. R.I.C.E. stands for rest, icing, compression, elevation. M.I.C.E. stands for movement, icing, compression, and elevation. So the only difference between the two is the M versus the R, and again, rest is for R is for rest, and M is for movement. So let's talk a little bit about when you'd want to use the R.I.C.E. and when would you want to use the M.I.C.E. So R.I.C.E. or resting it is only going to be used when you have a joint or a tendon that has suffered what's called a catastrophic injury. What's a catastrophic injury? A catastrophic injury means that you've broken, completely severed a tendon, okay? So, and you would figure that out through an MRI, and obviously the doctor would tell you that. The other thing is bone, completely broke a bone. You would want to rest a broken bone, okay? So depending upon the joint that it's at, we'll talk about the compression and the elevation in a second. But and then movement, on the other hand, M.I.C.E., you'd want anything less than a completely severed tendon or a broken bone. Let's say you have a bone bruise, or let's say you have like a small tear in a muscle, like grade 1 or 2. You'd want to actually keep those things kind of moving, because the studies and the research that has been done on this shows that if you continue to move one of those types of injuries, it will actually heal a lot faster, and it'll heal in a way that it's actually more movable and more usable in the future. Because what happens is when your body gets injured, let's say you have like a tear in a muscle, if you stop moving it, what happens is your body will start to lay down these fibrous connections and fibrous tissues, and those fibrous tissues will kind of lay down in more than likely a haphazard fashion. Your body just trying to stabilize it. Now, when you start to move and start to really actively work those muscles, they will start to align, those fibers will start to align along the normal tendon, normal muscle fiber lengths, okay? So that's why you'd want to actually move, and it also helps to, again, draw blood to the tissue and stimulate repair in that way, okay? So let's go with rest first, okay? So rest, ice, compression, elevation. So let's say that you have like a fracture in like one of your fingers or something like that. To stabilize that, or make sure it's not moving, you could actually just do like a simple buddy tape on it. Just take some tape, wrap it around that finger, and so every time you actually can't actively move that finger or bend that knuckle. Some obvious examples are, like, let's say it's a real big fracture. You'd want to go to an orthopedic specialist, an orthopedic doctor, and they would be able to provide a cast for you to make sure that joint is completely stable, and then you stay off of it that way, okay? Now, the other one, movement, you know how to move a joint, right? So just, so let's say anything less than that, you can keep things moving to help stimulate that. Now, icing. Icing, you could do many types of ice, or you can get a simple gel pack, put it in the freezer, take it out of the freezer, and the icing, how long you'd want to place the ice on for is no more than 20 minutes at a time. So you take 20 minutes on, at least 30 minutes to an hour off. And the reason that you'd want to do that is because if you have ice on an area or a tissue for too long, anything over than 20 minutes of ice, your body will start to think that those cells are going to be dying because they're not getting enough blood supply. And the ice is what is used to make sure that not a lot of blood gets rushing to that tissue. Okay, so let's say that we'll use our foot for an example for this one, or let's say you have a rolled ankle. So a rolled ankle, less than a grade 3/4 tendon break, or it's a small muscle tear. You would simply put the ice on the area. So let's say it's my leg. So let's say it's on the side of my foot. I rolled my ankle out. So I would place it on there, get a towel, small towel or a bandage, wrap it up around it, and this will provide the compression for the actual joint. So you just put that on there, wrap it up nice and tight, and then you could tape it off, or you don't really necessarily have to. And then for the elevation, as long as the joint is in an area that's above the heart, so it'd have to be above the heart. So let's say if it's the leg, I'd want to lay back to where my heart is below the actual area of the injury. So I would probably even want this a little bit higher to help the blood flush out of that joint there. That'll help decrease the swelling in that area, and so that you can start working on it and start actively moving it later on. Okay. So that's the icing. The compression. Compression helps to force blood out of that area, and elevation does the same thing. Helps to just get the blood out of that area there. So that's compression and elevation and icing. And that is R.I.C.E versus M.I.C.E. Enjoy.